Hi, I'm Jeff Todd with Prevent Blindness, and welcome to our Focus on Eye Health Expert Series. Today we'll be discussing cataracts with Dr. Albert Cheung, cataract, cornea, and anterior segment specialty ophthalmologist with Virginia Eye Consultants, and also an assistant professor at the Eastern Virginia Medical School Department of Ophthalmology. Welcome, Dr. Cheung.
It's a pleasure to be here, and I think it's great what you're doing to help educate people on these topics. So, as you said, I'm Albert Cheung. I'm in private practice at Virginia Eye Consultants in Southeast Virginia. I'm a cataract, cornea, anterior segment specialist there. I go to 3 of our offices, which are located in Norfolk, Suffolk, and Hampton. I also help with the medical school and medical students, as well as the ophthalmology residency. And so that's been a great thing to do. I originally grew up in Pennsylvania. I went to Penn State University College of Medicine to get my medical degree, and then went over to Michigan at William Beaumont Hospital there to do my ophthalmology residency. And then I traveled to Cincinnati to do a fellowship in cornea external disease. I also gained some experience in doing complex cataracts there.
Thanks so much. Well, here at Prevent Blindness, June is Cataract Awareness Month. Can you explain a bit to our audience what exactly cataracts are?
So, a cataract I always explain is a clouding of the lens. So the lens is located behind the iris. It helps focus light. So light comes into the eye, it helps focus it to the back of the eye, the retina, and then to the brain, so you get a clear image. And over time, the proteins in the lens can degrade, and then that's what causes the clouding or that opaque of the lens, opaqueness of the lens.
Well, besides the clouding, what are some other symptoms of cataract that folks should look out for?
You might see that clouding. Sometimes it's difficult, but if you look in the pupil, so in the middle part of that circular middle part of the iris, with dense cataracts, you might actually see that, or even in the very advanced cataracts, it becomes white. But oftentimes, people are having symptoms, as you mentioned before that. So a lot of times, images will become hazy or blurry. A lot of my patients will say that, fine print will be more difficult to see. Especially, for example, patients will be looking at a TV and notice that the ticker at the bottom is just not quite as clear. It can also change the prescription in your eyeglasses, so that's how things can become blurry. It can give you double vision, sometimes where you have 2 separate images because it splits light. It also may have more of just a ghosting, so just a slight offset of images. Because it scatters light, you might also notice, or patients might also notice that you might have a lot of glare, especially with oncoming lights. So with headlights, for example, at night, and this is particularly at night, I'd say, starbursts, halos, types of effects. Colors may not be as vibrant. Patients might not notice this as much because there's such a gradual onset, and even some of these other symptoms may not be as noticed until things are more advanced.
Are there different types of cataracts?
Your most common type is your age-related cataract, where you have the overall clouding, or getting more dense. The overall lens becomes more dense, just gradually over time. There are types of cataracts where certain parts of the lens can become denser more quickly. Those can give you symptoms, especially with glare, quicker than an overall clouding of the vision. You can have certain conditions such as diabetes or being on steroids that can cause a cataract in the back of the lens, especially in the center, that can be very significant early on, and even at younger ages. Those are more symptomatic a lot of times when the pupil becomes constricted. So for example, if in bright light situations, or you're trying to read, where your pupil becomes smaller, they can be more symptomatic. Other treatments such as radiation or even trauma can give you a cataracts, and then there are some that you can be born with as well.
Yeah, can you tell us a little bit about that? Tell us about pediatric cataract, and how would a parent know if their baby or young children have one?
If a child gets a cataract, we call that a pediatric cataract. They can be born with that, so it can be congenital. It could come from certain diseases as well as certain treatments. I think the most important thing to know about pediatric cataracts is that, or just in kids in general, they need a clear image in both eyes for the visual pathways in the brain to develop. If you don't have a good image in one eye, for example, the brain will shut off the vision in that eye, and that's called amblyopia, and that's essentially a lazy eye, and that you can't rehabilitate later on in life. And so the first 7 to 10 years is critical to get good images for both eyes to develop that vision. So definitely important to follow up with your doctor, eye doctor, for that. So in general, fortunately in the US, when you're in the hospital and you have a kid, they're going to screen for that right off the bat before the child, the newborn, leaves the hospital. And then even at your checkups later on, the pediatrician is screening for cataracts or lens opacities at each time. So you asked, what can parents do? So they can take note. So just like I was saying, in the pupillary space, right in the middle of the iris, the color part of your eye, they can look for a little cloud or a little white dot there. Sometimes you might see that with certain congenital cataracts. Sometimes what's more useful is actually if they take a picture, especially if they use a flash. So if you're straight on and you have a flash and you don't use that red reflex off feature, you'll get a red reflex. And even though it looks annoying sometimes in your pictures, it's actually very useful because you're actually seeing a natural reflex off the back of the eye. And so if there's something blocking it, whether it's the lens, for example, a cataract, or some type of congenital disease or disease early on, that might alert you to have that be checked out by an eye doctor.
Great, thank you. Such an important part of a child's growth is those early years, and connects so much to their learning as well. So as we age, we know that the higher the likelihood that we're going to get cataracts as we get older. Are there steps that we can take to help avoid them?
A great question. So, a lot of times we always suspect, UV light as being a contributor to cataract. So, protection from the sun and ultraviolet rays is always important. So wearing sunglasses, especially looking for that 100% UV protection label, wearing a hat in sunny conditions. Some other things, just taking care of your overall health can be good. Like I mentioned, diabetes can be a cause. So if you're a diabetic, making sure that's well controlled. Uncontrolled diabetes can lead to faster onset of cataracts. And then also smoking. That's a modifiable risk factor. And that can be a risk factor for cataracts in general.
Yeah, I have to tell my friends who ask these sorts of questions about how to take care of their eyes is, if you're taking care of your body, that's a good first step. Exactly. It all works all together. So let's talk a little bit about cataract surgery. We know that it's one of the most commonly performed surgeries in the US. Can you tell us a bit about what's involved?
Definitely, I think one of the most important things is to make sure you're getting your eyes checked on a regular basis. So when you're young, maybe every 2 years, and then as you get to age 50 and older, every year. Your optometrist, your ophthalmologist will be looking and checking for cataracts. When they deem it significant, they may set you up for a cataract evaluation or send you to a cataract surgeon to have that more fully evaluated. When you get to that evaluation, they might do a lot of measurements for you. So just expect those visits to be a little longer, and they'll talk to you about cataracts, educate you about that, and then also talk to you about the surgery and options. So you mentioned the surgery. So in general, it's outpatient surgery. You're going to be either in a surgery center or a hospital setting. You'll go there that day. They'll give you an IV so that they can relax you during cataract surgery. It can be a very anxiety-provoking experience, but they'll help you with that. You'll be comfortable. So a lot of times they'll numb the eye with either eye drops or with a nerve block. And then during the time of surgery, you're looking at lights. usually I explain to my patients that there's going to be mostly a light show. May feel a lot of fluid and some pressure. And overall, it's a relatively quick procedure. A lot of times between 10 to 20 minutes. During the surgery, your surgeon will use either a blade, laser to make small incisions to access the cataract. I always explain that the cataract is like a grape. It's got a clear skin and a cloudy pulp in the middle. So a lot of times we'll make an opening in that clear skin, use a special instrument with a special ultrasound to remove the cloudy pulp, and then replace that cloudy lens with a clear implant. And that'll help focus the light for you so you can see better. Those tiny incisions are often watertight and sealed without sutures. A lot of times you'll have a clear shield afterwards. And then they'll go over some restrictions, like things like maybe no heavy lifting, deep bending, water, dust into your eyes for about a week.
So I understand that many times some refractive errors may actually be corrected during cataract surgery. Is that the case? And how is that?
Yes. So fortunately, as we've gotten a lot better at this too. So those measurements I was telling you about will measure the length of your eye as well as the curvature of the cornea, and we can predict and really reduce the amount of glasses prescription a lot of times. So we're essentially putting that prescription in that implant that we place in your eye that's in place of the lens. We can also correct astigmatism, and we also have the opportunity to sometimes reduce or decrease your dependence on glasses. So we can sometimes give you a range of vision as well with those special implants.
So what's the success rate of cataract surgery, and how safe are they?
So in general, very safe and very effective. So in the US, rates of success, especially from a safety profile, in the high 90s. So about, some studies say 98%. In general, there are risks to surgery. So I always, counsel my patients that it is surgery, and there's risks such as decreased vision, especially things like infection. That's probably 1 in 1,000. So as you can see, that's pretty rare. Also, small risk of, for example, of inflammation that might last longer than the typical month. Also need for another procedure to improve the vision afterwards. That may include and may range from things to improve the focus of your vision afterwards if it wasn't quite what you wanted or desired. Also things like retina and glaucoma procedures if needed. So.
Got it. And how long does it typically take for a patient to recover from cataract surgery?
So overall, it's pretty fast. So I always tell patients, to expect symptoms of scratchiness, light sensitivity, blurry vision, especially the first few days. You're going to recover over that first week. Vision will sort of come in over the first few days, and usually by a week, we know where that vision is going to be, and then it continues to improve over that first month.
So as patients are preparing to undergo cataract surgery, are there things that they should do to prepare for it?
Yeah, so I think ask as many questions as you need for your surgeon so that you feel comfortable. Some things to know for the day of surgery, which is probably the most anxiety-provoking time, just because everything goes so fast, right? And it's new to each patient. So make sure you have a ride to the place, to the location. Make sure you have your drops ahead of time. Oftentimes you'll be on drops for about a month after surgery to decrease infection and inflammation. There'll either be combination drops or separate drops, and your surgeon will go over a schedule for you, but ask any questions about that. And then make sure something that some people always, sometimes, or not always, sometimes occasionally a patient will forget is to make sure you don't eat after midnight. And then we would hate to cancel the surgery that day just because you happen to eat.
Absolutely. Well, I have to say, I know so many people who have gone through this, and almost every one of them come out surprised and shocked at how much their lives have improved by having this simple surgery.
It's definitely a blessing to be able to take care of patients in this way. And that's one of the reasons why I went into ophthalmology, is you're able to make such a big difference in such a short period of time. And it's a lifelong difference you can make.
So as we come to the end of our conversation, I understand that you're an avid swimmer. So as we get into the summer months and people start hitting their pools, oceans, and lakes, what can we do to protect our eyes while we enjoy the water?
Yeah, that's great. No, I enjoy swimming. Just went swimming this morning. So first things, get protection for your eyes. So I always wear goggles, even though pools have chlorine. There are still microorganisms there, especially in lakes, oceans, and other water locations. So you want to sort of protect your eyes. You might have gotten away with opening your eyes underwater in certain situations, especially in those more natural settings, but you don't want to take the chance on a frequent basis. So that's one thing. Another is make sure you remove your contact lenses before getting into any of those into the water. The contacts just would trap, bacteria or other microorganisms such as acanthamoeba and make it more likely to get an infection. So one tip might be to get, if you're dependent on sort of glasses or the prescriptions to see, you might get prescription goggles, just like, sunglasses that you get prescription. You can also, check levels or how safe certain areas are if you're not sure. A lot of times the EPA or other agencies or, park recreation, they'll let you know which are the bacterial levels or which waters are safe to be in. So, and then chlorine can be a little irritative to the eyes as well. I'll add that. Just being a swimmer and water polo player in the past, where a lot of times didn't follow my own advice, where you might have some irritation to your eyes. So artificial tears right after can be very helpful in soothing the eye.
Great, thanks for that. Well, before we wrap up, is there anything else you'd like to say about cataract or eye health in general?
So one thing to know is that that clear skin that I mentioned, that is sort of a shell around the cataract, that we sort of use to place the implant. So as I mentioned, we made an opening in that front part. That back part is actually left in place most of the time, and so that can get cloudy over time. And so you might develop what's called a secondary cataract. So don't be surprised. That's probably the most common thing after cataract surgery, the clouding of that area. And your doctor can do a quick laser procedure called a YAG capsulotomy to restore any vision that might have been lost or decreased from a clouding in that area. Another thing to mention to your eye doctor, if you're undergoing a cataract evaluation, is if you've been on something called tamsulosin or Flomax, so those sort of prostate medications, it can actually cause the iris to be floppy during surgery. And so it's always nice from a surgeon point of view to know that up front.
Great. Well, thank you so much for joining us. And for those interested, you can find more information about cataract and eye health and safety at preventblindness.org. Thank you, Dr. Cheung.
No, thank you so much for having me. It was a pleasure.